Chief Public Attorney Silvestre A. Mossing.
The Public Attorney's Office presents this Lady Justice Statuette and Certificate of Appreciation to our speaker. In deep appreciation for the invaluable support and contribution made to the Public Attorney's Office as our resource person, which lead to the success of the 5th National Convention of the Rank and File Employees of the Public Attorney's Office on the 9th to 11th of October 2023 at the Philippine International Convention Center, given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
Our next awardee, Honorable Jose Arnulfo VELOSO, is a multi-awarded CEO and veteran banker within 36 years of banking experience. He served as the president of Influential Bankers Association of the Philippines until March 2022. In his role as BAP president, he collaborated closely with central bank policymakers at the Bangko Sentral ng Pilipinas and Congress to implement measures aimed at enhancing the service of the Philippine banking sector. Prior to this, he held the position of President and Chief Executive Officer at the Philippine National Bank. During his tenure, PNB received a recognition from Asian bankers as the best managed bank for its exceptional response to COVID-19 pandemic in 2020. Simultaneously, he was honored with the title of the Best CEO of the Asian Bankers Annual Leadership Achievements Award. He made history as the first Filipino to serve as the CEO of HSBC Philippines. Under his leadership, HSBC Philippines was awarded the Best Global Bank Award for 2018 and earned the title of the Best Debt House in the Philippines for multiple years, 2008 until 2012, 2014 to 2017. Additionally, HSBC received various industries recognition for its successful capital market transactions. He holds a bachelor's degree in commerce with a major in marketing management, which he earned from De La Salle University, Manila. Our awardee for Outstanding Public Servant, Honorable Jose Arnulfo VELOSO, President and General Manager, Government Service Insurance System. To receive the award in behalf of Honorable VELOSO is Ms. Rachel P. Edhan, Vice President, NCR Area 1, NCR Operations Group.
This Lady Justice Statuette and Certificate of Appreciation are given to our awardee in deep appreciation for the invaluable support and contribution made to the success of the Public Attorney's Office and the advancement of the interests of its clientele, given on the occasion of the 5th National Convention of the Rank and File Employees of the Public Attorney's Office on October 9 to 11, 2023 at the Philippine International Convention Center, given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
Congratulations. May we hear from our awardee?
Isang maginhawang buhay po sa ating lahat. Attorney Persida Acosta, fellow public servants, ladies and gentlemen. It is with honor and pride that I accept this award on behalf of my superior, the President and General Manager of the Government Service Insurance System, PGM WIC VELOSO, recognizing him as an outstanding public servant underscores his unwavering dedication to uplift the life of government workers and the transformative impact made. In the spirit of this recognition, we are reminded of the power of service and the difference it can make in the lives of others. PGM VELOSO's commitment to public service has been a guiding light, inspiring us all to reach higher, work harder, and give more. Thank you to the organizers for acknowledging PGM VELOSO's exceptional contributions. Let this award serve as a reminder of the impact and the importance of public service and the positive change it can bring. Thank you and maginhawang buhay po sa ating lahat.
Maraming salamat. Congratulations again to our awardee for Outstanding Public Servant, Jose Arnulfo Veloso, which is represented by Ms. Rachel T. Edhan.
Our next awardee, PGM Jose Arnulfo WIC VELOSO, is a multi-awarded CEO and veteran banker with Our next awardee, he is actively engaged in various professional roles and possesses a diverse background. He serves as a member of PhilHealth's expert panel and board of directors. He works as a power energy consultant to key players in the Philippine power sector, of President and CEO at the Power Sector Assets and Liabilities Management Corp, or SALM. In the past, he served as Managing Director and Country Head Philippines for the RBC Wealth Management Group at the Royal Bank of Canada, Hong Kong, during the period of 2008 to 2010. His educational background includes a Bachelor of Science degree in economics with a concentration in management from the University of the Philippines. Additionally, he pursued an MBA at the J.L. Kellogg Graduate School of Management, Northwestern University in Evanston, Illinois, USA. To accept the award for our awardee for Outstanding Public Servant, may we call on Attorney J. Villegas.
This Lady Justice Statuette and Certificate of Appreciation are given to our awardee in deep appreciation for the invaluable support and contribution made to the success of the Public Attorney's Office and the advancement of the interests of its clientele, given on the occasion of the 5th National Convention of the Rank-and-File Employees of the Public Attorney's Office on October 9 to 11, 2023 at the Philippine International Convention Center, given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
Once again, congratulations to our awardee for Outstanding Public Servant, Honorable Emmanuel R. LEDESMA Jr., President and CEO, Philippine Health Insurance. For the acceptance speech, again may we call on Attorney J. Villegas.
Good afternoon. Our PhilHealth President, Emmanuel LEDESMA Jr. is in the Senate as of this time. That is why I will read the message for you. To our Honorable DOJ Secretary Crispin Remulla, Chief Public Attorney Persida B. Acosta, distinguished guests, fellow colleagues in the public service, ladies and gentlemen, good afternoon to all of you. As I stand here before you, I am filled with immense pride and gratitude for the recognition that you have conferred on me. Truly, it is an honor to receive this award for Outstanding Public Servant during the 5th National Convention of the Rank and File Employees of Public Attorney's Office. I humbly believe that there are many yet which I have to achieve in order to be deserving of a recognition such as this. Nevertheless, I attribute this privilege to the hard work and dedication of my PhilHealth family. We are tirelessly serving the Filipino people, and whose unwavering support is the pillar of our achievements. Your theme for this convention holds great significance, kabalikat at kapangyarihan ng katarungan laban sa kahirapan, or the pillar and power of justice against poverty. These words are also embody the core values and principles we embrace in PhilHealth. Integrity, for one, is one of our values that I would like to highlight. I firmly believe that we can only do our mandate of providing accessible and affordable health care to every Filipino, if, of course, our workforce has strong moral principles and honesty. With integrity as our moral compass, PhilHealth will be more and more instrumental in ensuring access to quality health care for all, a value which drives us to continue working hard, ensuring that our objectives are gradually achieved despite many difficulties we may face. I would like to take this moment also to reflect on the profound impact that we have in the lives of millions of Filipinos. Remember that our work does not revolve around mere paperwork, numbers, or procedures. It revolves around people. People who entrust their well-being to us. Our actions hold the power to make difference in the lives of many individuals, to provide hope where there may be despair, and to lend a helping hand to those in need. This award also serves as catalyst for me and my PhilHealth family to strive even harder, to push boundaries, and to innovate more in order to improve the lives of our fellow Filipinos and bring about transformative change in our society. Once again, thank you to each and every one of you. This recognition belongs to all unsung heroes of PhilHealth. Maraming salamat at mabuhay po kayong lahat. Public Attorney's Office.
Thank you so much, Attorney J. Villegas, for accepting the award. Once again, our awardee for Outstanding Public Servant, Honorable Emmanuel R. LEDESMA Jr.
For our next lecturer, our lecturer has an extensive career at the Philippine Health Insurance Corporation, starting as a medical officer 2 in 1998 and eventually reached the position of medical specialist 4. Her roles encompasses various responsibilities, including serving as a medical evaluator, auditor of claims, and leading the medical evaluation unit in the Benefits Administration Section, BAS-Pro NCR Central. From 2020 to 2022, she also acted as a medical specialist 3 and designated officer of Benefits Administration Section, BAS-Pro NCR Central. Currently, she holds the position of Medical Specialist 4 in the Standard Monitoring Department within the Health Finance Policy sector. In terms of education, she obtained a Doctor of Medicine degree from the Fatima College of Medicine and a BS in Psychology from University of Santo Tomas. She also recently completed a Master's in Public Administration at the World City Colleges. Additionally, she holds professional certification as a DOH Certified International Classification of Disease 10 trainer. Ladies and gentlemen, to give us a brief about PhilHealth and updates and related matters, let us give a round of applause to Dr. LETICIA Gay AGUDA, MD, MPA, Medical Specialist 4, Standard Monitoring Department, Health Finance Policy Sector, Philippine Health Insurance Corporation.
Good afternoon, everyone. Good afternoon, PAO, officers and staff, guests, and fellow public servants. I was tasked to discuss briefly some PhilHealth updates. So, my discussion for today will focus mainly on benefits. Kasi ito naman po ang reason why we all want to be members of PhilHealth, we contribute payments, and then, kasi later on, wag naman sana when we get sick or we need medical services, we need the support from PhilHealth. So, PhilHealth is a government-owned and controlled corporation, and it is the largest purchaser of health services in the country today. It maintains a single health insurance fund from which payments for benefit availment of members are drawn. It administers the social health insurance program of the country, which is anchored on the concept of risk pooling and social solidarity, and draws inspiration from the Filipino trait of bayanihan. Now, in February 20, 2019, the Republic Act 11223, otherwise known as the Universal Healthcare Act, was signed by then-President Rodrigo Duterte. And this UHC bill simplified the flow of health resources in the country. Under the UHC law, the Department of Health and the local government units are being made responsible for population-based intervention, while our office, PhilHealth, is responsible for individual-based health services financing. The Universal Healthcare Act is guided by 4 key principles: that we as a nation adopt an integrated and comprehensive approach to ensure health literacy, healthy living, and protection from hazards and risks. Develop a healthcare model that provides comprehensive health services without causing financial hardship to our citizens. specifically to the poor and the marginalized members of our society. Pursue a whole-of-system, a whole-of-government, and a whole-of-society approach in the development of health policies. And lastly, adhere to people-oriented approach centered on our people's health needs and well-being. Under Section 5 of the Universal Healthcare Law, it states that every Filipino citizen shall be automatically included in the National Health Insurance Program, here and after referred to as the program. Now, how do we register to PhilHealth? We as employees of the government, kayo po sa PAO, kami sa PhilHealth, are automatic members na ng PhilHealth. But for others, you just have to properly accomplish and originally sign our form, the PhilHealth Member Registration Form, or the PMRF. If necessary or for validation purposes, supporting documents may be needed, like your birth certificate or marriage contract, and at least one valid ID. Now, at present, our membership are categorized into two main groups, the indirect contributors and the direct contributors. Now, the indirect contributors consist of the indigents as identified by the DSWD, or the Department of Social Welfare and Services. This is the listahanan. Those belonging to the PORPIS, or the Pantawid Pamilyang Pilipino Program, the Sangguniang Kabataan officials as defined in RA 10742, persons with disability, senior citizens who are not currently covered by the program, and all Filipinos aged 21 years old and above without the capacity to pay the premium payments. Now, who are the direct contributors? First, the employees with formal employment. Dito po tayo kasali as government employees. The OFWs, the kasambahay, the self-earning individuals and professional practitioners, Filipinos living abroad or dual citizens or naturalized Filipinos, and lifetime members. Now, the funding will come from direct contributors through their premium contributions, and from the indirect contributors like funds from the Syntax, PCSO, and PAGCOR. Now, RA 11223 or UHC Act, yung Section 10.1, this is the premium contributions of direct contributors. The premium rate shall be in accordance with this following schedule and monthly income floor and ceiling. So ito po yung basis ng ating premium rates. Now, we go to the benefits. Siyempre, nagpa-member tayo, we pay our premium contribution because later on, wag naman sana, if we need these benefits para maka-avail po tayo. What are the current benefits given by PhilHealth? This includes inpatient benefits. Ito po yung kapag na-admit tayo sa hospital or na-confine. Then outpatient benefits. Ito po yung mga day surgeries or outpatient procedures, chemotherapy, radiotherapy, hemodialysis, and medical detoxification. And as of now, yung ating primary care benefit, which is the PhilHealth Consulta. Now, PhilHealth also has special benefits. Ito po yung mga catastrophic cases o yung medyo malalalang sakit. The Z benefits, and these include yung kung meron tayong acute lymphocytic leukemia, breast cancer, prostate cancer, kapag ka nagkaroon po tayo ng bypass operation sa heart or your CABG, coronary artery bypass graft, operation sa heart, usually congenital diseases para sa mga babies, yung ating total correction ng tetralogy of Fallot or TOF, closure of ventricular septal defect, and yan, for infants po to, and then cervical cancer, orthopedic implants. We also have benefits yung peritoneal dialysis, and for colon and rectal cancer and children with disabilities. We also have the Millennium Development Goal-related benefits. Ito po yung mga sa panganganak, maternity care, the normal spontaneous delivery package, prenatal care or the newborn care package. Meron din tayong outpatient TB, DOTS package, animal bite, malaria, and for HIV/AIDS package. Now, during the pandemic, PhilHealth also came up with COVID-19 related benefits. Now, these are the inpatient benefits. As mentioned po, benefits for sickness or ailments that need confinement of not less than 24 hours. Now, what are covered? So ano po ang covered sa inpatient benefits? Both medical and surgical or procedural cases. So kung may medical kayong sakit, for example, hypertension, pneumonia, kasama yan, na-confine kayo. Kung you underwent surgical procedures or operation, cholecystectomy, appendectomy, kasama po siya. Now, who are the providers? These are accredited hospital and primary care facilities with beds, including infirmaries and dispensaries. Ano po yung services? So what are the services? This includes the facility fee, which include the room and board, the drugs and medicines, lahat po ng gamot na ibibigay sa inyo while confined, laboratories and diagnostic tests, kasama din po yan, and the professional fee or the payment for the doctors attending to you, surgeon, anesthesiologist, other specialists. Now, what is the payment mechanism? At present, case-based payment or fixed rate across all member categories. So, regardless po kung direct contributor kayo or indirect, pare-pareho po yung benefits. Each medical case or surgical procedure has a corresponding amount o case rate amount sa package. Now, what are these all case rate payment mechanism? Case-based payment is a payment method that reimburses to healthcare providers a predetermined fixed rate for each treated case or disease. So it is also called per case payment. And as of now, case rate is the fixed rate or amount that PhilHealth will reimburse for specific illness or case. And this shall cover fees for the healthcare professionals or the doctors and the facility charges or the hospital charges. And as I've mentioned, included na po yung room and board, laboratories and diagnostic tests, the drugs and medicines, supplies, and operating room fees or other fees and charges of the hospital. Case rate payment shall be in medical conditions and procedures and identified surgeries and other select procedures done in accredited healthcare institution. Just make sure po na you are confined or you avail of the services in PhilHealth accredited facilities. Now, what are the sample of this medical case? So, kung nagkaroon po kayo ng dengue, pneumonia, nandyan po yung package rate. Regardless kung anong hospital, level 1, level 2 facility, regardless kung employed kayo, direct contributors or indirect, it's the same rate po ng package. Nandyan po, pneumonia, kung moderate risk, kung high risk, kung ang diagnosis nyo upon discharge is hypertension, nandyan po yung corresponding rate. Kung kayo ay na-stroke, cerebral infarction, nandyan din po. Acute gastroenteritis, kung medyo nag-diarrhea kayo, asthma, typhoid fever. So yan po ang sample ng mga medical cases. Now, for procedure case rate, example po, kung you underwent radiotherapy, dialysis, nanganak kayo, cesarean section or normal delivery, appendectomy, cholecystectomy, DNC, naraspa kayo, thyroidectomy, hysterectomy. So, cataract surgery, one of the most common na outpatient surgical procedure. So, yan po ang fixed rate. Regardless nga po ng membership at kung anong hospital, fixed po yung payment. Now, for the outpatient benefits, day surgeries and outpatient treatment procedures, including po yung mga TB package, HIV, and dialysis. So what are covered? Yung procedures or surgeries less than 24 hours confinement or outpatient basis. So outpatient lang po siya na may procedure. And who provides? Siyempre po, ang provider are accredited healthcare providers, which include hospitals, ambulatory surgical clinics, primary care facilities, dialysis clinics, maternity clinics, lying in animal bite centers, and TB DOTS clinics. Just make sure po accredited siya ng PhilHealth. What are the services? Included po again yung hospital fee, room and board, drugs and meds, if there are laboratories and diagnostic done, and the professional fee or the doctor's fee. The payment mechanism again is case-based payment or fixed rate across all member categories. So pare-pareho lang po siya regardless of membership. Now, another outpatient na PhilHealth is trying to promote at this time, yung aming primary care benefit na konsulta. These are outpatient benefits po na parang check-up natin. Who are eligible? All Filipinos. And sino po ang provider? All accredited outpatient clinics. And ang payment mechanism po ay through capitation. The primary care benefit, which may also be availed on an outpatient basis, was expanded to cover all Filipinos. So ito na nga po yung konsulta package. And PhilHealth allotted a fixed amount per individual who will enlist to a konsulta provider. Now, these are the services that may be availed under konsulta package depending on the risk and need of the patient. So patient consultation, there are diagnostic tests and medications that would be provided. So the targeted services in the consulta package, first yung services, initial and follow-up consultation with primary care providers. So meron pong first patient encounter and follow-up consultation. And then targeted health risk screening and assessment. So kung meron pong high risk kayo for cancer, breast exam, or rectal exam. And then these are the basic laboratories that would be provided: CBC, urinalysis, fecalysis, lipid profile, your FBS, your oral glucose tolerance test, chest x-ray, ECG, and CREA. Now, for the medicines, included po dyan yung antimicrobials or your antibiotics. If ever merong infection na nakita sa inyo, this would be provided. Amoxicillin, coamoxiclav. And then fluid and electrolytes. Kung sakaling merong diarrhea, kailangan ng fluids, oral rehydration salts. Then anti-asthma. Antipyretics, kung tayo ay nilalagnat, paracetamol. Anti-dyslipidemia, kung mataas ang ating cholesterol, anti-diabetic, anti-hypertensive, and anti-thrombotics. So these are the services, laboratories, and medicines that can be availed of kung mag-register po tayo as konsulta member. Now next is our Z benefits. In 2012, PhilHealth introduced the case-based benefit package for selected catastrophic medical conditions that will require prolonged hospitalization. These are considered extremely expensive therapies or treatments that can deplete a family's financial resources. Kaya po siya tinawag na Z-benefit catastrophic. And they are referred to as Z-benefit package and may be availed by members in contracted hospitals upon passing the selection criteria for each Z-benefit package. So included po dyan, as I've mentioned before, yung acute lymphocytic leukemia. As of now po, yung package rate niya ay hindi na 210,000 but 500,000. Kung may breast cancer kayo, stages 0 to 3A, 100,000, including po ang operation, kung kailangang may tanggalin, mastectomy, and the chemotherapy, prostate cancer, your end-stage renal disease kapag nag-require po ng kidney transplantation. If you can see, yung package rate niya ay 600,000. Now, kung kailangan naman ng bypass operation sa heart, your coronary artery bypass graft surgery, 550,000. And other heart operation for children. For example, yung TOF, 320,000. So catastrophic siya kasi life-threatening, financially depleting sa income ng family, but PhilHealth is providing also medyo po malaking amount of benefits. Now, another part of Z-benefit is your Z-morph o yung orthosis or rehabilitation prosthesis. So kung kailangan ng prosthesis, below the knee, nagkaroon ng amputation, above the knee, or ankle foot prosthesis or other orthosis, andyan po yung ating package rate. Meron din po tayong Z-benefit for peritoneal dialysis. 270,000 per year po yan. Colon and rectal cancer, depende po kung colon or rectum, nandyan po yung corresponding amount. And also for premature newborns, to prevention of premature delivery, preterm and small newborns na who needs essential interventions, and then preterm and small newborns po. So may mga categories po siya with the corresponding package rate. And these are under the Z-benefit packages. Now, other benefit packages are also available, most of which are in response to the country's efforts to meet the Millennium Development Goals or your MDG-related benefits. And these include yung maternity care package natin na kapag nanganak kayo, pag hospital, 6.5, and then kung non-hospital or lying in, andyan po yung corresponding amount. Normal spontaneous delivery, nandiyan din po yung newborn care package. So yung need ng newborn, kailangan ng vitamin K, at yung other hearing test, newborn screening test, part po siya ng package. Malaria, TB, HIV, animal bite package, and even contraceptive implant benefit. So all these can be availed in accredited PhilHealth providers na nagbibigay po nitong benefits na ito. Next is although medyo parang tapos na tayo sa COVID, but in response to COVID-19 pandemic, PhilHealth developed a set of benefit packages for the spectrum of care for COVID-19. And these are the policies and circulars to guide in the implementation of COVID-19. So, nagkaroon po tayo, nung kasagsagan ng COVID in 2020, meron po tayong benefit for testing and ang facility laboratory. So, siguro naka-avail tayo niyan, yung RT-PCR test, and then benefit packages for inpatient care for COVID, and then specifically for health workers, iba din po ang package, and then nagkaroon din tayo ng community isolation benefit. Now, these are the summary of the benefits and their corresponding rates. So, hindi na siya masyadong applicable, but during that time, at the height of the pandemic, ang COVID po ay kinategorize natin kung mild case, 43,000, moderate case, until sa critical care case, which is 786,000 po yung benefit. Now, sa health workers po, binigyan natin ng full financial risk protection. So, full billed amount po after appropriate deduction. These are the COVID packages. And then yung pong testing, nagkaroon tayo ng RT-PCR testing. And then yung mga na-isolate po sa accredited CCIBP or your community isolation benefits and package, meron din pong corresponding benefit. Ito po ay ginamit natin lahat during the height of the pandemic. PhilHealth also has coverage for emergency medical services. Ito po yung resuscitation package and referral package. Now, your resuscitation package is your claims for confinement of less than 24 hours if the patient expired, even if beyond the service capability of the hospital. So halimbawa po, may isinugod kayo sa hospital, less than 24 hours or sa ER pa lang, nag-expire siya, you could claim a case rate of 4,000 for resuscitation. Now yung P00, that's the package code, and these claims are subject to post-audit monitoring and evaluation. Kasi we check if the claim or the patient was really given resuscitation. Ni-revive ba siya? Yun lang nga, unfortunately, nag-expire siya, less than 24 hours, the member can get a case rate of 4,000. Referral package. Halimbawa po, tinakbo nyo sa ospital, hindi tinanggap, halimbawa medyo serious na yung case niya, and they have to refer the patient to a higher level of facility. So ito po yung referral or transfer of patient from one hospital to another for the same medical condition. Sample, wala silang ICU. So you have to transfer the patient to a tertiary hospital. The referring hospital shall be paid with a fixed amount of 4,000. So yung pinanggalinghang hospital, pwede kayong makaklaim ng 4,000 and the full case rate package shall be paid to the referral or receiving hospital. So kung nailipat nyo na siya, kung ano man po yung diagnosis doon, kung ano yung case rate amount, yun po yung matatanggap nyong benefit. So yung pinagreferan, yung pinanggalingan, meron pong 4,000 referral package. Now, for more information regarding your benefits, you could visit our website. Tingnan nyo po yung aming online services. Although lately, alam nyo naman po yung naging problema namin with regards to the ransomware. But I think the website has been, naibalik po siya last week. Now, you would go to our portal and check. Pwede nyo pong malaman. For example, na-confine kayo, diarrhea. So, hanapin nyo po dun sa benefits, my benefits. Andyan po, my portal. Ita-type nyo lang po ano yung diagnosis. Pwede nyong malaman kay doktor. Or kung talaga namang halimbawa, asthmatic kayo, may asthma, i-type nyo lang po. Yung ICD code, that's the code for the medical diagnosis. So kahit hindi nyo alam yung code, you could just write the diagnosis. Kung alam nyo naman, nasugod sa hospital dahil hypertensive, na-admit siya. So i-type nyo po dun sa description, hypertension. Yung RVS codes are codes for surgical procedures. Ngayon, kung hindi naman nyo alam yung code because these are known to the hospital staff, PhilHealth staff, or sa amin sa PhilHealth, you could just type appendectomy, cesarean section, and then masa-search nyo po how much. So, more or less, may idea kayo how much would be the benefit. Or, pwede rin nyo pong i-download All Case Rate Search sa mobile app. Nandun po siya sa Play Store. Hanapin nyo lang po, i-download nyo yung All Case Rate Search, and then masa-search nyo rin po dyan yung benefits. Kasi yan naman yung una nating concern, di ba? Pag na-admit, na-hospitalized, or if you are going to undergo an outpatient procedure. For example, may excision, debridement, or suturing, yung mga outpatient, pwede nyo po siyang i-search dyan sa All Case Rate Search sa inyong mobile app. Now, in summary, sa UHC po, sa Universal Healthcare, ang aspiration natin for the population is automatic inclusion of every Filipino citizen into the National Health Insurance Program. So immediate eligibility po sa UHC. Wala pong tatanggihan ng benefits dahil lang walang premium contribution. So yun lang po, kailangan upon admission mag-enroll as member ng PhilHealth. The service coverage, immediate eligibility, and access to population-based and individual-based health services. Financial coverage to reduce the out-of-pocket expenditure of Filipinos for health services. Now, under the UHC law, mayroon din pong guarantees, or these are the PhilHealth key deliverables. Automatic coverage po again, hindi na kailangan ng ID, kahit walang premium payment, hindi po tatanggihan ang patient ng benefits. Yun lang po, kailangan mag-enroll upon admission. Now, comprehensive outpatient benefit package, we are starting with the consulta package na we are trying to invite our health, yung mga municipal health clinics natin, yung mga health centers to have their clinic accredited for consulta. And then contracting of networks, incentives to deliver quality of care. Now, also PhilHealth from ACR po ngayon, we are also gearing towards the global budget and the diagnostic-related group. So, mas magiging enhanced po yung benefits once we adopt this global budget and DRG payment scheme. and costing facilities and services. So yan po ang deliverables that we are working into under the Universal Healthcare Law. So let me end by sharing with you the vision of PhilHealth. Bawat Pilipino miyembro, bawat miyembro protektado, kalusugan ng lahat, segurado. And it is our mission that to give all Filipinos benepisyong sapat at serbisyong de kalidad para sa lahat. Maraming salamat po at magandang hapon sa inyo lahat.
Once again, thank you so much, Dr. Leticia Gay Aguda, MD, MPA, Medical Specialist 4. To confer the award to our distinguished speaker, may we call on our Deputy Chief Public Attorney, Sylvester Mosing.
The Public Attorney's Office presents this Lady Justice Statuette and Certificate of Appreciation to our speaker. In deep appreciation for the invaluable support and contribution made to the Public Attorney's Office as our resource person, which lead to the success of the 5th National Convention of the Rank and File Employees of the Public Attorney's Office. On the 9th to 11th of October 2023 at the Philippine International Convention Center. Given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
Thank you so much, Dr. Aguda. And of course, our Deputy Chief Public Attorney, Sylvester Mosing. Kamusta po? Okay pa kayo? Hi! Hello! Okay, I'll call on Luzon! Kamusta kayo? Ayun. Parang mahina. Isa pa, ha? Luzon! Visayas! Yung isa, kumakain pa eh. Napaano yung kumakain, pero grabe. Okay, Mindanao! Kahit pala may laman yung bibig, no? Pwedeng... Alright, we have a special guest. She is referred to as Asia's timeless diva. Do you know her?
Diva. Ano sabihin ng diva?
Diva, a lady singer.
Wow! Okay.
She holds a prominent position as one of the judges on ABS-CBN's Tawag ng Tanghalan, featured in the show It's Showtime. As a highly acclaimed singer, she boasts a multitude of international awards, including grand prize victories at the 4th Asian Singing Competition in 1979, the Asia Pacific Singing Contest in 1988 in Hong Kong, and the first runner-up placement at the 3rd ABU Popular Song Festival in Malaysia. She also achieved first runner-up recognition at the Australia Open Entertainment Competition in 2002. Her illustrious career encompasses 30 albums, including 12 solo albums, showcasing her remarkable vocal talent. Known as the movie theme song queen, she has lent her voice to more than 30 movie theme songs, leaving an inedible mark on the world of cinema and music. Ladies and gentlemen, may I present to you our awardee for Outstanding Performer, DULCE!
This Lady Justice Statuette and Certificate of Appreciation are given to our awardee in deep appreciation for the invaluable support and contribution made to the success of the Public Attorney's Office and the advancement of the interests of its clientele. Given on the occasion of the 5th National Convention of the Rank and File Employees of the Public Attorney's Office on October 9 to 11, 2023 at the Philippine International Convention Center, given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
A warm of applause for DULCE.
Thank you so much. Maraming salamat po. Magandang hapon sa inyong lahat. Sabi ko kay Attorney, Madam Chief, sabi ko, di ba kakanta naman ako? Doon na lang yung parang hahaba pa ang oras pag magsasalita. But anyway, maraming salamat po sa binigay na parangal na ito. Parang ang haba ng mga kinuwento. Ma'am, God bless you more and more and the Public Attorney's Office, sa inyong lahat po. At maraming salamat sa mga pagkakataon po na binibigay niyo sa akin. Katulad ngayon na nandito at makapag-share ng talent na ibinigay sa atin ng Panginoon. God bless everyone. Thank you so much. Thank you. Kanta na ako, ma'am. Okay. Tugtog na tayo. Ay, okay. Thank you. Thank you, miss. Ayan, sige. Aawitin ko po ang aking kaisa-isang jukebox hit. Anak, tugtog. Paano kung wala ka na? Hindi pwede. Paano ba ang mag-isa mula nang makasama ka? Kung paano'y limot ko na, paano ang pag-ibig ko? Kung di rin lang laan sa'yo ang buhay ng ating mundo, hindi ko alam kung paano. Bago ka lumisan, sana'y maturuan mo na iwasan ang bawat nakasanayan ko at limutin na ang maghintay lagi sa'yo. Paano ba ito? Oh, kay daming bagay na hindi ko na alam, tulad ng lumuhat sa'yo ay magdamdam dahil naniwalang labis mo akong mahal. Laman ng bawat mong dasal, paanong aking gagawin kung di mo na ako pansin? Kung ito'y panaginip din, paano ba ang magising? Bago ka lumisan, sana'y maturuan mo na iwasan ang bawat nakasanayan ko at limutin na ang maghintay lagi sa'yo. Paano ba ito? Nakakatuwa naman kayo. Di ba pa kayo nagsawa sa akin? Lagi na lang ako Maraming salamat. Maraming salamat. Doon sa napakahaba-habang mga binasa, ang huli po doon, ako po tayo lagi isang misyonera. I am always out in the fields for the mission fields to share the gospel, of course. And salamat po sa mga panahon. Ito na mag-i-emote na naman ako. Madam Chief, salamat sa tulong mo sa akin palagi. And nandiyan ka nagpapalakas sa akin. Alam naman ng marami mga nangyayari sa buhay-buhay. Thank you. And it is such a wonderful opportunity to be able to be with the PAO. Sa inyong lahat po sa Public Attorney's Office, I pray that the Lord will continue to bless you and cover you. And divine protection be with you always. Kasi alam ko po napakahirap ng inyong ginagampanan, ng inyong ginagawa to serve our mga kababayans. And I just would like to express that appreciation to each and every one of you na nagsisilbi po sa Public Attorney's Office. Ito pong susunod na awit ay sadyang para sa inyo pong lahat. Sa inyo pong lahat. Sa inyo, Madam Chief. Maestro, please. Sa kanyang pagguha, minsan pa'y hagkan ng langit ang lupa, ihalo na muli ang ginto sa tingga, isabog sa buhangin ang bato ang bawat butil, upang minsan pa lahat pag-isahin. Minsan pa'y pawiin natin sa malayang hangin ang mga sigaw at nakabibinging daing, isabog ang katarungan sa buong sandaigdigan, upang minsan pa sa daigdig maghari pag-ibig. Minsan ay painumin ang uhaw sa tuwa, pahirin ang mga matang nalulunod sa luha, yakapin ang nagiginaw sa ating pagkalinga, lapitan at bihisan ang hubad sa laya. Minsan pa'y hagkan ng langit ang lupa, ihalo na muli ang ginto sa tingga, isabog sa buhangin ang bato ang bawat butil, upang minsan pa lahat pag-isahin. Minsan pa'y pawiin natin sa malayang hangin ang mga sigaw at nakabibinging daing, isabog ang katarungan sa buong sandaigdigan, upang sa buhay ninyo. Pagpalain kayo lubos. Maraming salamat.
Alam nyo, Amor, alam ko may hinihintay kayo eh. May hinihintay kayong awit. Kasi minsan talaga bigo tayo, no? Kumbaga tayo, bugbog sarado, no? Maraming pagsubok, parang talo tayo palagi, no? Pero hindi. Para kay Ate Dulce, lagi tayong nagwawagi. Saka alam natin na ang Panginoon Diyos ay nasa atin. Hindi niya tayo pababayaan. Anumang pagsubok, kabiguan, sa dako pa roon ng ating buhay. Tayo, ako ang nagwagi. Di ba? Talagang special request to eh. Dahil alam niya, paborito ko tong kantang to eh. Alam niyo ba, may CD niya ako. May CD din ako na may medley. Araw-araw pinapatugtog ko yun eh, bago matulog. Dahil meron akong cassette recorder doon, merong CD player. Hindi pwedeng hindi ko pakinggan ang awiting ito. Kaya pa?
Yes, ma'am.
Kaya natin yan.
Yes.
Sige.
Okay, ito. O kahit ano po. Sige. I will bring you to the crossover, to the message of the song that George Canseco rewrote 7 days before he passed away. Maestro, please. Ako ang nagawagi, kailan may di na maaari pang masawi. Everyone born of God overcomes the world. And this is the victory that has overcome the world, our faith. Who is it that overcomes the world? Only he who believes that Jesus is the Son of God. Okay, saya ko, malaya nang sumusunod kay Kristo, na kaya ng talikuran ang tukso, pagkat siya na ang buhay ko. Ang sabi nila, ako'y larawan ng ligaya't saya, mapalad kailan may di mag-iisa, dahil Jesus kasama ka. Ako ang nagwagi, kailan may di na maribang masawi, maling landas, di tatahaging puli. Buhay ko'y hawak niya, bawat sandali. Ako ang nagwagi, ang kasalanan ko'y kaniyang binawi. Ako ay pinatawad na. Kay ganda ng gawad niya. Salamat na lang, mayroong Jesus, bugtong anak ng Diyos. Dugo niya ang sa krus ay ibinuhos, upang mundo ay matubos. Ako ang nagwagi, kailan may di na maaari pang masawi, maling landas di tatahaging puli. Buhay ko'y hawak niya, bawat sandali. Ako ang nagawagi, ang kasalanan ko'y kaniyang binawi. Ako ay pinatawad ibinuhos upang mundo ay matubos na kaniyang mahal. If anyone is in Christ, he is a new creation. The old has gone, the new has come. Kung ang kahapon ko'y sawi, ngayon ako ang nagwagi. You are victorious. Kayo ang nagwagi. Tayo ang nagwagi. Thank you, ma'am. Thank you, ladies and gentlemen. Okay lang, Bisaya? Hala, sure kayo dyan? O anak, binisaya tayo. Dali.
Oh, tayo nga yung mga Bisaya dyan. Tayo nga yung mga Bisaya. Naku, marami palang Bisaya.
Okay. Okay. Tugtog day. Asa naman to? Ani kining mga awit nga isuwat sa ato mga pinalanggang kompositor sa tibuok Kabisayan ug Mindanao. Dandansoy bayaan ta ikaw sa mga taga Panay Island pauli ako sa payaw ugaling kun ikaw hidlawon ang payaw imulang lantawon dandansoy kun imo apasun bisan tubig di magpadlan ugaling kun ikaw uhamon sa dalan magbubun-bubun. O kining sunod nga awit gisuwat sa usa ka Sugbuanon samtang nagpuyo sa Davao sa dihang nagsuroy-suroy siya sa Bohol. Usahay magadamgo ako nga ikaw ug ako nagkahigugmay ug nganong damguhon ko ikaw damguhon sa kanunay sa akong kapingaw usahay kasing-kasing ko magbasol nga nabuhi ning kalibutan nganong gitiaw-tiawan ang kugmakukan nimo sa mga Sugbuanon ani asiro sa pangdangikan paintawon sa kabukiran kaninyo makikuban-uban ning gisaulog ninyong kalingawan palitaw day akong puhunan maoy kabilin sa akong ginikanan awit nga labing karaan nga garbo sa atong kabunturan
Ayay sa akong balitaw, manindot pa mo sayaw, daw yamog sa kabugnaw. Tikadung, intaw no sab si Dudong, nagtanaw, kang inday, nagkabisay ang laway. Aruy, ani asibulak sa mga kahidlaw. Aruy, di ka pa maluoy, ning pobreng alindahaw. Aruy, ani asibulak sa mga kahidlaw. Di ka pa maluoy, ning pobreng alindahaw. Di ka pa maluoy, ning pobreng alindahaw. Di ka pa maluoy, ning pobreng Daghan kaayong salamat. Thank you so much. Pinapaupo lang ko ni ma'am. Thank you. Okay na ko, ma'am. Pwede na ako baba. Baba. Hindi pa?
Grabe. Wala bang malakas na palakpakan dyan? Libre yan. Kung sa iba may bayad yan, pero dito sa PAW, libre. Ha? With DULCE, ladies and gentlemen,
Thank you.
our awardee for outstanding performer, singer, and actress. Thank you so much po, Ma'am DULCE. More na naman. Okay, our next awardee for outstanding civic leader. He is a founder of Euro TV Cares and holds the position of President, Chief Executive Officer at Euro TV Philippines. Additionally, he is the founder and convener of One Maharlika. He holds the title of Datu Panihag within the Manobo tribe. He is the chairman and founder of the Gawad Filipino Awards, and is the founder, convener of Ahon sa Kahirapan. He has achieved the academic distinction of Doctor of Philosophy and Humanities. Friends, guests, ladies and gentlemen, our awardee for outstanding civic leader, Dr. Danilo B. Mangahas, Datu Panihag, civic leader. Let's give him a round of applause.
This Lady Justice Statuette and Certificate of Appreciation are given to our awardee in deep appreciation for the invaluable support and contribution made to the success of the Public Attorney's Office and the advancement of the interests of its clientele. Given on the occasion of the 5th National Convention of the Rank and File Employees of the Public Attorney's Office on October 9 to 11, 2023 at the Philippine International Convention Center, given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
Let's hear his acceptance fee of Dr. Danilo B. Mangahas.
Napakahirap po magsalita sapagkat napakataas po na enerhiyang iniwan ni Miss Dulce. Lalo po akong kinabahan para magsalita po ngayong araw na to. Pero before that, maganda nga po, ako nga pala po si Dr. Danny Mangahas, mas kilala po na Datu Panihag mula po sa Manobo Tribe. Ang atin ko pong kasuotan ngayon ay mula po sa Manobo dahil sineselebrate po namin ngayong araw ang Indigenous Month. Ngayon po ay buwan ng mga katutubo. Pero siyempre dahil po ang inyo pong okasyon ngayon, maraming salamat po. Aking pong pagbati sa inyong ika-5 National Convention on the rank and file employees of the Public Attorney's Office na may temang kabalikat, katarungan, laban sa kahirapan. Isang karangalan po ang muli mapagbigyan ng pagkakataon na makapagsalita sa harapan po ninyo sapagkat talaga namang ang ating pong Public Attorney's Office ay siyempre nangunguna sa pinakamatapang at may pinakapaninindigan ang Public Attorney's Office. Sa pangunguna po, palapakan po natin ni Dr. Attorney Rueda-Acosta. Ayan po. Ma'am, maraming salamat po sa inyo. At bilang pagbabalik po sa pabalik tanaw, ang Public Attorney's Office po ay naging katuwang ng mga Pilipino, patuloy na mga kabataang Pilipinong katutubo na patuloy na bibiktima ng diskriminasyon, pang-aalipusta sa lipunan. Parang dahil po sa sibilisadong aming mga ancestral domain na pinangangalagaan po ninyo, kayo po ang naging nagtatanggol po sa amin bilang mga kapatid na katutubo, lalong-lalo po dun sa mga liblib na lugar. Alam po namin na kayo po ang nagiging takbuhan ng mga aming kapatid na katutubo. Hindi na po namin kahabaan, pero bilang chairman po ng Ahon sa Kahirapan na may bilang na marami na po sa iba't ibang sulok ng Pilipinas, kunin na po namin yung pagkakataon. Pwede ba namin mahiram si Attorney Acosta? Mukhang kailangan na po natin ng isang attorney, Persida Acosta, sa Senado. Pwede po ba? Pwede na po ba si Attorney Acosta sa Senado? Ma'am, mahiram po namin kayo. Sana po, pagbigyan po tayo sa 2025. Maraming salamat po sa inyo lahat at congratulations po.
Once again, our awardee for Outstanding Civic Leader, Dr. Danilo B. Mangahas.
Our next awardee, she is an owner and founder of Amigo Molina Trading Company. Additionally, she holds the position of CEO and founder of Aura Beauty and Wellness. In her role as a chairwoman at the Global Trend Business Leader Awards and as president of the ASEAN Excellent Achievers Award, she plays key leadership roles. Furthermore, she served as the chairman of the Gawad Maharlika Award. Her accomplishments and influence in the business world has been recognized as she has graced the covers of both Crystal and the Lady Boss magazine for women entrepreneurs and business leaders. She is characterized as a woman with entrepreneurial mindset and a dreamer who has achieved proven success as a respected leader. Her actions have a significant impact, inspiring changes and empowering others. Ladies and gentlemen, our awardee for Outstanding Civic Leader, Ms. Benelin Amigo Molina, President, Aura Group of Companies.
This Lady Justice Statuette and Certificate of Appreciation are given to our awardee in deep appreciation for the invaluable support and contribution made to the success of the Public Attorney's Office and the advancement of the interests of its clientele. Given on the occasion of the 5th National Convention of the Rank and File Employees of the Public Attorney's Office on October 9 to 11, 2023 at the Philippine International Convention Center, given this day of October in Pasay City, Philippines. Signed by Dr. Persida V. Rueda-Acosta, DSD, Chief Public Attorney.
May I call on again Ms. Benelin Amigo Molina for her acceptance speech.
Magandang hapon po sa inyong lahat. Isa pong malaking karangalan para sa akin na mapabilang na mabigyan ng karangalan mula sa PAO Office. Ito pong binigay sa akin na gawad ay isang isang inspirasyon para sa akin na gawin ko pa yung mas nakakabuti sa marami at kung ano pa yung maitutulong natin para sa sambayan ng Pilipino. Isa po si Atty. Persida sa nagiging inspirasyon namin para lalong matatag at maging malakas pa para maipaglaban po yung karapatan at ikakabuti ng ating mga mamamayang Pilipino. Bilang isang organisasyon po na nagbibigay ng gawad, ang ganito pong karangalan ay napakasarap sa aking pakiramdam sapagkat napapatunayan po na ang aming mga ginagawa ay nasa tamang direksyon na makapagbigay pa ng lalong inspirasyon sa ating mga kababayan. Maraming pong salamat, Dr. Atty. Persida Acosta, at sa lahat ng bumubuo ng organisasyong ito sa karangalang ipinagkaloob niyo sa amin. Maraming salamat.
Once again, our awardee for Outstanding Civic Leader, Ms. Beneline Amigo Molina, Chairperson, Aura Group of Companies. Congratulations. Kamusta kayo? Ha? Oh, di ba? O wala bang malakas na palakpakan pa dyan? Oh, ayan, nako. Mukhang nag-enjoy tayo, ha? Konti na lang.